Good morning, everyone. Please wave at me if you have any difficulty hearing me during the presentation. Firstly, I'd too also like to acknowledge the traditional custodians of the land on which we're meeting today and pay my respects to their elders past, present and emerging. So thank you for inviting me to talk today. I know an overview of Queensland Health and its structure might not be the most interesting topic, but I will try to make it as interesting as possible. So Queensland Health, as you know, is the state's largest healthcare provider and, as you know, delivers a range of integrated services. This includes hospital inpatient, outpatient and emergency services, community and mental health services, aged care services, as well as public health and health promotion programs. And that's just to name a few. Queensland Health is committed to ensuring all Queenslanders, wherever they are located in the state, have access to a public hospital and a broad range of healthcare services to meet their needs. We aim to deliver world-class healthcare to ensure good health and well-being of people and their communities all over Queensland. Next slide, please. So the department provides leadership and direction and works collaboratively to enable the health system to deliver health services that are safe and responsive for Queenslanders. The department is made up of a number of divisions and agencies, which you can see on the slide in the right-hand column. From corporate services that manages things like HR to eHealth Queensland, who manages the various technology solutions that you might see in each of our hospital and health services, such as electronic medical records. COVID-19 has resulted in an unprecedented disruption to Queensland Health and the broader health system, and many parts of our organisation have had to respond in a different way of operating. So to be sustainable and resilient during the ongoing disruption in the environment that COVID-19 has created. The department and the system responded rapidly in light of the pandemic to establish support functions across the organisation and develop strategies to realign similar and synergistic functions to new groups. By leveraging existing efficiencies, an operating model has been brought together that can flex up and flex down as required during the ongoing COVID-19 response and even into the recovery phases. As some of you may know, a reform and recovery group has also been established to work closely with a broad range of stakeholders to identify opportunities for the health system to reshape beyond the pandemic. It is a really exciting time for health, and whilst we have a long way to go, the pandemic has enabled us to rapidly deliver care differently and as a system identify new opportunities. Next slide, please. So a little bit about the organisation structure. So Queensland Health consists of the Department of Health, which in itself has 11 divisions and over 20 branches and units, including the Queensland Ambulance Service and our 16 independent hospital and health services situated across the state. So what is the difference between the department and hospital and health services, I hear you ask? So HHSs operate as independent statutory bodies governed by their own professional hospital and health board chief executive. People generally think that HHSs are the hospitals when they think about Queensland Health. However, they are so much broader than just the hospital itself, and they deliver all types of healthcare services. I thought I'd give you an example of how the interaction between the department and HHSs interact. One example is the Hospital and Health Board recruitment process. Each year, each hospital and health service need to appoint or reappoint their board members. Within the department, there is a dedicated team in the Office of Statutory Agencies, which forms part of the Office of the Director General, who manage this end-to-end process. That team are then also responsible for supporting the board's onboarding and throughout the year organising meetings and trainings to support each of those boards. The Hospital and Health Board Act provides the overarching framework for the delivery of publicly funded health services in Queensland. The funding agreements with each HHS is another good example of how the department structure supports each individual hospital and health service. Another division within the department structure is the Healthcare Purchasing and System Performance Division. They work closely with each HHS to understand their healthcare delivery needs and demands to help finalise their funding agreements each year. The department ultimately supports HHSs and is responsible for the overall management of Queensland Health's public system at a statewide level. Next slide, please. So as I mentioned, our role is very much around strategic leadership, and we provide the direction, working collaboratively and enabling the health system to deliver quality services that's responsive for Queenslanders. Next slide, please. So what is our vision and our purpose? So ultimately, Queensland Health's ultimate goal is to have healthier Queenslanders. Our values drive the work that we do every day, and the value of the system, partnering with consumers or patients, enables us to even deliver better quality and safer healthcare for all Queenslanders. Next slide, please. So how do we get there? I suppose in summary, to achieve that goal, it's guided by a number of key priorities. In Queensland and within Queensland Health, there are hundreds of programs and projects which shape our portfolio or how we deliver care every year. But this is defined by a few things. Firstly, to promote and protect the health of Queenslanders where they live, work and play, drive the safest and highest quality services possible, improve access to healthcare or health services for disadvantaged Queenslanders, pursue partnerships with consumers, communities, health and other organisations to achieve those goals. We empower consumers and health professionals through the availability of data and digital innovations. And we set the agenda through integrated policy planning, funding, implementation of efforts. We lead a workforce which is excellent and has a vibrant culture and a workplace environment. So in summary, I know that Queensland Health is a complex beast, but it is a friendly and warming place where everything we do improves the lives of Queenslanders. I encourage you all to chat to various people across the department and our system to understand more of their subject matter areas and also read the Queensland Health Strategic Plan. Thank you for inviting me to speak today. I hope I've given you a general, very broad overview of the difference between the department and hospital and health services, but happy to take any questions.
Thanks, Aimee. So thank you so much. As I'm wrapping up, I will ask if people can pop any questions for Aimee into the chat box. But as Jo said in the chat, we invited Aimee along today to come and talk to us about the overview of the department, as understanding how it works really does help consumers to influence and shape the health system. You need to understand what it is that you want to change to be able to most effectively change it. So thanks to Aimee for providing that overview.